Hey, this is Dr. Jay Calvert. I am the medical director of the Roxbury Clinic and Surgery Center, a board certified plastic surgeon, and the director of the Marina Rocks Fellowship. You are listening to Interview with a Surgeon with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Jay Calvert, Beverly Hills plastic surgeon. Doc, how are we doing today?
Doing great. Just got done seeing about 30 people and ready to chat a little bit about what we do here.
Well, I appreciate it. So kind of starting out, what were your goals and aspirations during your residency?
Well, during residency, my goals were really focused on gaining skills and gaining the technical ability to do surgery at the highest level possible. I really focused on being involved in as many cases as I could, really prepping the cases, learning everything about what I was doing so that I would build my fund of knowledge. But really, I needed to do the operations and practice to get the techniques. As a resident, it is the focus of what you're doing.
So as you're going through your chief year, what was your mentality like heading into your first job search, and how that perspective changed the beginning years of your career?
Well, my goals, interestingly, were to get into an academic job. I really wanted to do reconstructive surgery of the face and nose, and I was very interested in microsurgery, things that are not part of my practice now. But I was really focused on finding a place where I could do a lot of that, but at the same time being in an academic setting where I could continue doing research and all the other things I was doing. The way that I got my first job was my wife said, we are not living in Pittsburgh anymore. So I think I get to pick the place that we go, and it's either Arizona or California. And so we focused our kind of attention in those areas. And I did everything from look at the permutations of doing solo private practice in Phoenix, Arizona, to joining the staff of a university faculty. And ultimately, I wound up taking a job in academics at UC Irvine. And it was Bill Schwartz, who was one of my mentors at Pittsburgh, who connected me to Greg Evans, who had just come to UCI to take over the runnings of the UC Irvine division of plastic surgery.
What would you say were some of the keys to your success that shaped your early career that allowed you to get to where you are today?
Well, one thing that was really important is I found professional mentors. I knew that as a young faculty member, I was going to need somebody to show me the ropes on how to run a practice, how to build a practice, how to send letters, for referrals, how to bill insurance, how to take call properly. There were so many things I didn't know how to do as a faculty member because I was very much resident focused, as you might imagine. After 7 years of being a resident, it was like learning a whole new dialogue that really was foreign to me at that point. I had had some insight into it with, we had a little bit of, having guys come in who were in private practice to talk about how to do things. But it was nowhere near the drinking from the fire hose that you were doing as a new faculty member. And so I looked for mentors, and I found those mentors in the community by literally calling people up. And I was on staff at UCI. I was a tenure track professor there. Assistant, when I started, I was assistant professor of clinical surgery. And that was a tenure track position, but I treated it like I was doing my research, yes, but also very much running a private practice within the university. So I reached out to the private practice guys, Roland Daniel, Malcolm Paul, Ivan Turpin. There was just a ton of people that I wound up interacting with. I would basically call them up and say, hey, will Art Salebian, will Dr. Salebian have lunch with me? And I want to hear what he thinks about how I should run this whole show. And they all accepted. It was kind of cool. Lunch with David Furness. I mean, it was a really valuable sort of insight from my professors back at Pittsburgh. They said, meet as many plastic surgeons as you can and ask them how you can help. And it was very helpful.
Now, you're involved with training the next generation. So, what advice do you have for chief presidents and fellows entering the professional job market for the first time?
Uh, well, there's a ton. Some of the key points that you have to remember is that whatever you think you know, it is going to be very different than what it is you need to know. And however much you think you know about doing your practice, you know very little. So I think the key is to be open to hearing how to do things. Keep your mind open to the fact that maybe somebody who's been there before knows a little something about what they're doing and what you're trying to do. Because I see a lot of people make mistakes they come out with this incredible confidence that they've got it and it's totally under control. And I don't need to talk to anybody. I'm going to do this my way. They tend to, they say you pay to go to school. Well, you see that these guys really pay. They, and guys and girls, they just make mistakes, and they make mistakes that were totally avoidable if they checked their ego at the door and walked in with a deferential inquisitiveness as to what it is that they need to do. And it's really hard to watch sometimes because, people really crash and burn, and they crash and burn for big money. Surgery is not, it's not a small dollars game. If you're talking about playing in sort of the big markets in Dallas and Beverly Hills and New York and Boston, San Francisco, any of these, Chicago, any of these big locations, you're talking about huge money swings if you make a mistake. In other areas, you can come out and you're not trying to do a big aesthetic practice or some sort of, huge deal where, you're buying a building and building a surgery center and all that. If you're taking a job, then I think you're a lot better off because you can get some mentorship. And I was fortunate to be at UC Irvine for 3.5 years prior to going into private practice. And I think without that, I think I would have really made some very bad mistakes.
Now, as a director of one of the top aesthetic fellowship programs in the country, what are you looking for when you're interviewing candidates for those few fellowship spots?
We look for people that, number one, we want to hang out with for a year because it is a year of having them in the practice. Our fellows are part of the way that I take care of patients. They're around all the time. They interact with the patients. They are, they're on call. They take calls from the patients. And I need somebody that I can have around first. With that said, we want to find people with the real, we want people that want to be aesthetic all-stars, that really are going to get into aesthetic surgery, not because they think they're going to make a lot of money and, have a cushy lifestyle. I would argue that those of us that really practice at this level, like the money and there's no cushy lifestyle, first of all. So everybody who thinks that they're going to get some easy way of doing things or whatever needs to forget about that unless you want to be average. If you want to be average, you're right. You could have a cushy lifestyle. But if you want to practice at this level, you gotta gun it every day. I still treat every day like I'm a resident. I treat every day like I am going to work with a healthy sense of urgency, a sense that today is the best day of what I'm doing. I need to do the best that I possibly can. And every operation I do, I see it as the opportunity to do the best operation I've ever done. And I never look at it as though today is like an easy day or it's a day to phone it in. That is not part of how you practice aesthetic surgery. If you want to be great, you want to really treat your patients well and deliver them the best results you can, then you have to get out of your own way and open your ears, listen to what they're saying, take the feedback, really be understanding that there's no perfect way to do any type of surgery. It's all about the artistry. It's all about the anatomy. It's all about you being able to hear and really listen to what's being said and what's being told to you from your follow-ups, from your pre-op appointments, from your staff, from the anesthesiologist, from everybody around you, and really integrate and get that area under the curve on whether you're doing the best that you can or how you can be better. And that's not for everybody. A lot of people want a job. If you want a job, then get a job. But you want to do aesthetic surgery at this level and really deliver something special to your patients, you got to be all in.
Now, over the years, you've been involved in many different societies. Do you hold any current positions?
I am the immediate past president of the Rhinoplasty Society. So that means that I'm involved in a lot of the administrative work, but I'm done with all of my big planning and all that. I'm part of the a few committees but it's still, I'm in the executive committee for the Rhinoplasty Society, and I'm a board member of the LA Society of Plastic Surgeons.
Now, within those different societies, what type of resources are you providing to the next generation?
Well, it depends on what level, whether they're medical students, residents, fellows. The Rhinoplasty Society, I believe, still isn't charging residents to come, but it may be like $150. But whatever it is, it's extremely discounted because we want the residents to learn about nasal surgery. Same thing for the LA Society. I think that they have some special pricing for the residents. I think are invited and allowed to come, but we definitely support their education. And these forums are amazing for that. You're talking about at the LA Society, I can tell you when we have a meeting, the powerhouse of plastic surgeons that are in that room is striking. I mean, it is a lot of people that do a lot of national teaching and international teaching. It's people with booming practices. It's really something. And I love the LA Society. It's really great, from the people that are friends to all the new members that we're gaining. It is a very special educational organization, and it's got a very significant level of camaraderie that I'm not sure exists in other cities. We really are happy to see each other and to be on the team for each other and to really make the community, because the reality is that Beverly Hills Plastic Surgery is a brand, right? It really is a brand in and of itself. And so we want it to be the best. We continue to care for it and cultivate that brand. And that comes from really everybody being the best that they can around you, in addition to yourself. And there are so many patients in Los Angeles and Beverly Hills. It's hard for people to be sort of cutthroat about getting the there. It's like just, there are a lot of people here. So we don't have that kind of competition. I mean, right now in this building that I'm in the Roxanne building, there's got to be 5 or 6 surgery centers, and every one of them is just going gangbusters. It's just busy. So I love that LA Society. And then the Rhinoplasty Society is the same thing. It's the best educational experience in rhinoplasty there is. And very proud to have been president, to have served the executive committee for many years, and will continue to do so until they don't need me anymore. And then I can just pay my money and show up to the meeting, which will be great. I've been around a long time, and that's one of the really cool parts of that, is just to see these organizations grow and get better and really hone the mission. And so it's really been a great experience. And I encourage young residents and fellows to get involved.
So thinking back, if you had to do this journey all over again, what advice would you have given your younger self before starting?
That's a good question. I think the main thing would be, it's really good to come from a really rich family. That's very helpful. But if you can't do that, I would tell you and this is what I did, because I listened to a guy named Carl Manstein, who's a plastic surgeon from Philadelphia. And Carl's a genius. He's made a lot of money being really smart. And what he said at a meeting, and I'd love to get his feedback on it someday, he said, live like a resident for the first 5 years after you finish your residency. Keep your overhead low. Don't go get the country club membership. Don't buy the fancy car. And, for those of you who come from a very wealthy background, that you can do all that stuff because it doesn't matter. I know one resident showed up at his first day of work in a Bugatti. So like that, he probably doesn't really need to do a whole lot of facelifts if you're already in the Bugatti by the time you start your practice. but I wasn't. And I had debt, pretty significant, from Cornell Med and Vanderbilt. And you got to really keep it low. So live like a resident for 5 years. The people that I know that have done that have done really well. They are financially successful. The people that went out and bought all the big stuff and leveraged themselves, they've always had a hard time getting past that. The other thing I would tell you is that you don't know anything. And when you finish your residency, start over like you're doing your residency, but it's got a different spin to it. Now it's all about, how do I take care of my patients and deliver them the best results? Because as a resident, I don't think that's the true focus, even though you're assisting the big shot surgeons and doing all that work. You're not there with the concept, I have to see this person tomorrow, because most of the time you don't. And so you miss that. Even though you do see them, you see them around the hospital and you're making rounds on them, you don't have the ownership that you do. And so I would probably tell my former self to throw out everything that you learned as a resident from a how to take care of patients standpoint, and step back and observe and really be capable of hearing the feedback. This is a hard thing, because you think after all that time you should know something, and you definitely do, but you don't know the information for doing the new job that you've now taken. It's a different focus and a different way of being. So you got to be flexible. You got to let the fact that this is new wash over you a little bit, and get out of your own way so that you can rise to the levels that you are truly, really interested in achieving. And I think that the people that can't get out of their own way and can't get the ego under control, and they can't clamp down on their ADHD, these are people that have a very hard time. And it's hard because some people aren't built for it. And those who are can really excel, but you have to have a very enlightened sense of, okay, I'm going to be humble. I'm going to keep this ego in check, because I do rhinoplasty, so I have no ego. I've been beaten to a pulp by my own results and what it is to do this, because no matter what I do, it's never perfect. I mean, I do a lot of great rhinoplasties, a lot of great, reconstructions, but there's always something that could be better. And so we'll learn from that. And that it didn't take me too long to learn that, because I started doing rhinoplasty in large volumes pretty much right away. And that spanked me pretty hard, which is good. And if you don't think you're going to get spanked, well, you will, I promise. Something will come and really show you the way to listen and to be dialed in for your patients. So those are sort of the two things I would tell people.
So you and I both have a love for hockey. Can you kind of talk about the Dr. Hockey podcast?
Sure. The Dr. Hockey podcast is it's funny because now, I have the Beverly Hills Plastic Surgery podcast, which is about all this stuff. And it's really good. People have dialed in to that in a big way. But the hockey podcast has actually become very medically oriented about hockey. And so it kind of allows me to combine my love of hockey with my kind of medical background and not just plastic surgery. But, we've had, it's funny how some of these people that have been on the podcast for medical issues have become patients of mine. Number one, we had Mia Khalifa on the podcast when she was hit in the breast implant by a whizzing hockey puck in a playoff game from the Tampa Bay Lightning. And, she had problems from that. She lost a lot of soft tissue. And so we came to have her on. And then you can see it on YouTube. There's a whole big video about how we fixed it. But it's really fun. I'm a huge hockey fan. If I show up in a city and there's an NHL game that night, I'm going. I mean, I really love to watch hockey. I am a Pittsburgh Penguins fan, but I have Ducks season tickets. I love the Rangers. I'm, all about the LA Kings. I go to Kings games all the time. And, it's just it's really been my sport, and I love being involved with it. And doing the podcast is great. We've had everybody on that podcast. We had Timu Solani on the podcast. We've had We got to the NHL awards one year, and I interviewed Connor McDavid and Sidney Crosby and Brent Burns. I mean, it's been a just total blast.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.